Hello and welcome to Beaute Espace TV. We have here today with us Dr. Shehla Agarwal. She is an eminent dermatologist in Delhi and 15 years of experience and an alumni of the prestigious Maulana Azad Medical College, New Delhi. She has been involved not only very deeply with her profession, which she has been successfully at it for so many years, but also she is known for her philanthropic ventures and working with the government in the field of education and with the Aurobindo group as well. So welcome, Dr. Shehla Agarwal. Welcome to Beaute Espace TV. How are you today?
Thank you so much. It's my pleasure, especially in today's times, if I get a chance to smile and to talk to a very nice person who's giving me positive vibes. There's nothing like it. There's nothing like it.
Thank you so much. So, Dr. Mir, you have a very special, experience in dermatology, and the kind of clients that you get in Delhi. I'm sure that they're just not only from a certain class, but all classes and all kind of ailments you're dealing with when it comes to skin. Apart from, of course, the cosmetic part of it, starting from Botox to fillers and all that's becoming a real rage in certain age groups and certain socioeconomic sections. Now, we would first like to understand your main milestones as you have evolved in your practice over the years.
You said 15 years. It's actually been 20 years. I think the time flies on.
Yeah.
We were trained as dermatologists. My degree is MBBS and MD. MD in dermatology, venereology and leprosy. So there was no cosmetology. And believe me, that was the time that if you told a dermatologist, are you a cosmetic person? So everybody would get very offended.
Yes.
They wanted to do hardcore dermatology, and our textbooks. Dermatology is a very difficult branch because as an undergraduate, we are not taught anything about skin except for maybe, common ailments like scabies and leprosy. When you land into a postgraduate course, you realize how vast the subject is. But the vastness as it is, once you come into practice, you realize what you have read or what you were writing sitting in a government hospital, now you don't use it because people are coming to you with different problems. The aims are different, their aspirations are different. So somehow the other, I passed out my MD in 1997. I am ancient, no doubt about it.
Thanks for reading that.
Then 97, 98, you being in the beauty industry will realize was the time when people were getting aware of cosmetic procedures.
Yes.
And all the peels and lasers had started coming into India. But the problem was that they were coming to people. The machines were costly. Dermatologists didn't have that much money, to start the practice with. So the plastic surgeons were buying it. So, and they were using it left, right, and center. And they had, I'm sorry to say to my plastic surgery colleagues, but they had no idea of what dermatology is, what skin is, what hormones are.
Yeah.
And believe me, I have seen patients burnt by the glycolic peels because they didn't know how things were. So then that, literally, opened our eyes, and we as a dermatologist community started saying, what the hell are they doing? They don't know anything about it. They're trying to emulate the West. In the West, this has been done since past 50 years. But you have to understand that the Western skin, the Western environment and the Western lifestyle is very different from India. So you can't export something from there and, as a same with the same standards you start using in Indian conditions. It will fall back. It will bounce back. So that's what was happening. So in our lifetime, we actually have seen from dermatologists going to becoming cosmetic dermatologists and aestheticians. Now everybody very proudly writes cosmetic dermatologist. so now, and believe me, now in Maulana Azad Medical College and All India Institute of Medical Sciences, There, people are doing thesis on facials. People are doing thesis on hair coloring. I'm glad that the teaching has changed and it's going where it's needed.
Yeah. So, what have your main learnings been over the years?
uh, when I wanted to go into cosmetology, what initially happened was that as a dermatologist, as a doctor, it was a pen and paper prescription. You write a prescription, you send the patient away, the patient takes the medicine.
Right.
Okay, but what happens after the ailment has become okay? Suppose let's talk about acne. Acne is so common. You have treated the acne, but who will treat the acne scars? Who will make the skin normal? So what I would do is that I had associated with parlors around my clinic, and I had gone and talked to the girls over there, trained them, asked them, okay, this is I want. Like, I don't want scrubbing. On my acne patients, if you scrub the skin, it will become very irritant. So I'll go and talk to them and I'll tell them, can you please do this for my patient? And can you, like, do not do this and do it this way, make it, treat them hygienically, because as these patients are very irritable, the skin is very irritable. And if you again go into harsh procedures, the difference between the cosmetology and dermatology was, which over the years have improved, was the basic knowledge about skin structure. They were doing things, but they were doing it blindly. They didn't know कि scrub कर रहे हैं तो क्या scrub कर रहे हैं भाई, तुम्हें कोई रेगमाल तो नहीं लगाना है. You don't have to, like, rub the skin off. That's what was being done. You know how things have evolved, but we never have those finer bleaches and scrubs what is available now. Now everybody uses the beaded scrubs. Earlier that day it used to be only walnut scrubs and things like that.
Walnut and
yeah. So what will happen was that the patient will get more scarred. So I actually had started going. So then the parlor people also realized that what she's saying is slightly correct. So they started inviting me over to treat, to teach the girls about basic dermatology. I associated. Then the different change came when I associated with another company who were launching a product, and they realized that a dermatological opinion is very important. So what I did was, I associated with them and I traveled all over the country and gave the lectures where the audience was the beauticians.
right.
But the procedure was, first I would come and explain the disease and the skin. Like if they were doing a depigmenting treatment, so I'll explain what is melasma. If they're doing an acne treatment, I'll explain what is acne. And then they will launch their product. So it became hugely successful. And believe me, Ritoo, when I stood on that stage and there were all those, seasoned beauticians, they would look at me and say, "Ye hame kya sikhayenge," comings and all. So I was very clear. I said, "मैं यहाँ सिखाने नहीं आई हूँ, मैं आपसे सीखने आई हूँ."
That's extremely humble of you, I must say, because I have heard the other way also. The other way in this industry where the doctors don't want to associate with the parlors and they don't want anything to do with it.
They're wrong, because 90% of the population will be going to the parlors.
Right.
Only 10% of the population. As I always say, कि मेरे पास तो sensitive skin आती है, मेरे पास कोई normal skin थोड़ी लेके आएगा.
Right.
So to keep that normal skin normal, we had to go to their arena.
That education has to happen. So hats off to you for taking it up and putting your ego aside and saying, okay, what? I am MBBS, MD. I take responsibility for what's happening.
The start of the lecture used to be like this, and after it used to be like this.
So moving from that, Shehla, we're going to be talking about a little bit about what will happen in the future. Do you visualize any disruptions? We know that laser is now like everywhere. Like everyone is trying to do lasers. Anybody who's even a class A salon would like to offer a laser service on their menu at least. Exactly. But that again, very the personnel have to be really trained properly, and you're playing with people's skin and ultimately their self-esteems and so on. So how do you see that? You have also you developed a training module in that.
Yeah.
What does that training module comprise of? First, tell us. and then we'll talk of the disruptions.
Yeah. There is a gap between, as you rightly said, the beautician and the doctor part of it. Both are in their own world and both don't want to connect. But fortunately, National Skills Development Corporation, it's a Government of India initiative. They develop these courses where we train the girls to enhance their skill set. Right. So even the beautician part of it, this program enhances their skill set to become cosmetic therapists. So rather than just being a beautician or a cosmetologist, they become cosmetic therapists. Now, cosmetic therapist, the aim is, first of all, you have to know what the procedure is. Second, you have to know the pre-procedure details, because you will be the one who will be dealing. Doctor comes for 2 minutes, does the laser and goes off, but you are the one who are talking to the person in the pre-procedure period. Then you are the ones who are giving a post-procedure care, and you should be the one who should know A to Z of the procedure. You might not know that the laser is 1032 hazard. You don't need to know, but you need to know that the laser reaches till the hair, it is absorbed by melanin. So, because people have all these queries, is it harmful? Will it cause cancer? How deep will it go? So you should be sound enough in your knowledge to know what you are doing, where it is going. And I have been training people for past 7 to 8 years. Initially, those girls needed a doctor to stand with them. Now they are, a technician in themselves, because they are confident that what they are doing is right. Initially, when we train them, and it's a 8-week module, so we have associated different parlors. Like I do it in my clinic. The girl comes over here and we teach her in the lasers, we teach her in the peels, we teach her in the mesotherapy. Latest we are doing is PRP, the vampire facials, which are the latest norm. So we are teaching the basic, what is the procedure basically, the details of the procedure and how you are helping in the procedure. Correct. Believe me, the confidence level of the girls who came here and they were, "Nahi ma'am, we can't do, we are not that well educated, we don't know how to do." I said, you go ahead, beta. As you go with the flow, you will know how things are. So this is something which we should, any parlor who is planning to do peels. Aajkal peels everybody is doing, because ready-made peels are there, and lasers everybody wants to put, and they hire a technician. You have to know which laser. So the girls should be trained like this. So, and ILFS is the site where you go. If you search for it, the cosmetic therapist program is there. You can enroll your girls. The charges are around 5,000 or something, and we want these charges to be borne by the employer. The girl should not bear it. Yeah. What problem I faced, which most of the salon owners called me up, कि मैम जैसे ही सीख लेते हैं तो एट्रिशन हो जाता है, कोई ले जाता है, पे हम करते हैं और वो नॉलेज कोई और यूज करता है. तो उसका तरीका यही निकाला है कि देन यू फाइल अ बॉन्ड, मतलब यू से कि यू हैव अ 2-year bond or something like that, कि for 2 years you will do this. So these kind of courses, the whole idea is that in today's world you can't survive only doing facials and bleaching and waxing, because people are aware. Oh yes. In my clinic, every 2 years, I have to add a treatment or a therapy, get it from outside, because people ask, "Ma'am, what next?" So it's always what next. So that's why. So that's the whole thing. In future, lots of changes have to be done, but we'll get to that.
So, doctor, we are also experiencing so much pollution, I mean, during COVID, we have for the first time experienced green card. I mean, maybe in my lifetime, I'm experiencing it for the first time.
It's the positives of COVID.
So and the sun, strong as it is getting every day with the global warming. What are the disruptions you see? What are the things that are needed in this? Where is the science going? What different disruptions you're going to see? What do you think is required? What kind, where do you think the research should focus? What kind of, when you're doing these treatments, do you feel the lack of a certain kind of technology or certain kind of medication that if you had, things would have looked better?
Yeah, the biggest problem we face is, as I earlier also said, all these treatments are, imported from the West, and we do it over here. The West does not have 45 degrees temperature. The West does not have the pollution, and the West does not cook for a long time standing in front of the gas stove where the heat is directly coming to your face. So, and if you ask the person to apply a sunscreen, they apply it as a cosmetic right in the morning. They'll apply, go out and forget about it.
Yes.
Let's go to the type of skin. You know that there are 6 skin types, 1 to 6 depending on the color of our skin, the melanin content of our skin. 1 being the whitest and 6 being the blackest skin. We come somewhere 4 to 5. All of us somewhere fall 3 to 5.
Oh.
The problem with this kind of skin is that we have enough melanin layer to protect us from the kind of sun we have for a limited number of time. But the another problem is we don't burn in the sun, because that's an inherent protection. Now, because we don't burn in the sun, we are not very cautious of reapplying sunscreen. The white person will burn.
Yes.
So they automatically, if you have your skin burnt once, now you'll never forget it in your lifetime, and you'll never forget your sunscreen. But fortunately or unfortunately, our skin type is that we don't burn. Because we don't burn, so we don't realize the importance of that sunscreen. It becomes just like another cream you apply at 8 o'clock in the morning, and you say, "Ho gaya sunscreen for the day." So, and the matter is that the sunscreen, any SPF, will become ineffective in 2 hours, because it's an active product. You have applied it on the skin. It goes to a dermal layer. It forms the layer. Blood flow comes and it goes away. So every 2 hours, the blood flow is circulating and it goes away. So unless and until you are reapplying the sunscreen every 2 hours, it's of no value.
Right.
आप बच्चे को सुबह लगा के भेज रहे हो, 2 बजे वो बस के लिए आएगा, तो वो सनस्क्रीन सुबह वाली थोड़ी बैठी होगी वहां. So you have to understand, first of all, sunscreen is needed only from 11 a.m. to 4 p.m.
Right.
Because that's the time when the UVB, UVA are the straight. Before that, they are slanting, and then they are slanting, so you don't need the sunscreen. Right. If you have to apply, you'll apply at 11, and you have to apply at least 20 minutes before you go out in the sun. It's not a cream, it's not a moisturizer. It has to travel in the skin to reach dermis. So these things are very important. The most important for our kind, and we sweat a lot. So when you sweat, the sunscreen just goes away. Yes. So ideally what you should do is you apply the sunscreen, then you take I'm looking for a compact. You take a compact powder and apply on that, because it mattifies the whole area, and plus it doesn't let you sweat. So the sunscreen lasts longer. Now, जब हम sunscreen और skin की बात करते हैं तो मेल फीमेल दोनों बराबर आ जाते हैं. अब मेल्स को बड़ी टेंशन है कि वो कुछ नहीं लगाते हैं, but the skin is the same. So if you apply even calamine lotion, which is basically a physical sunscreen, it will do the job. And that's why, Ritoo, the treatments in our scenario where we are doing no treatment, no peel, no laser, nothing has been effective in treatment of melasma. Melasma is the chaya, the pregnancy shadow which you get. It's a hormonal treatment, and it's a hormonal cause. And again, because the sun is so high, if I do anything over here, the moment you go out in the sun, the skin produces the melanin again, because it's producing it as a protective mechanism. So if a person comes to me saying that I have 2-3 years of melasma, I say I can try, but I will not promise that it will go. So fortunately now we have oral medicines. Glutathione is one of the things, that's the whitening treatment of the film industry. So one question which is always asked to me, how do these actresses change their color for permanent?
So it doesn't have any side effects? What does it do?
So, you cannot take it on your own, because it has to be under supervision, because we'll be supervised. Like if I'm giving you something, I'll give it for 3 months, I'll give a gap, I'll get the blood test done. I know where it is going through. Yeah. So it's not, I'll see whether your liver is okay, whether your kidney is okay. If you start taking it on your own, And the problem is the side effects are not immediate. It's not that today you take it, tomorrow you develop into an allergy. 10 years hence, you might develop something which you'll not even connect to the thing which was given to you.
Oh.
That's the whole problem. So self-medication, self-treatments, for that matter, even the peels, we share the industry somewhere. You come from one part of the industry, I come from the other part of the industry. The problem is that these two have to meet. Otherwise, and I have to tell you one thing. I was associated with one of the international brands as their customer care person, where there was any problem. So they would ask the person to reach me. Mostly people were having problem with the hair dyes and any other kind of issue. What started happening was the MNC didn't want to get any jhanjat, so they started paying off the patients behind my back. I'm trying to treat the person, and as such, if you're on a panel of some company, the patient has so much of mistrust because they feel that you are their doctor, so you take their side. Though I had nothing to do with them, they were only paying my consultation, which you would have paid if you came to me as a patient. So when the company started paying the patients behind my back, I said, this is not done, because then why am I solving the issue?
Correct.
So the whole industry, the beauty industry, the cosmetic industry, they have to understand that sometimes anything can cause a problem. And if it causes a problem, then you have to take the person in that much confidence that it's not us, we did it. It is because it can happen. Allergy can happen. So that confidence will only come if you have an educated person at your back.
Yeah, and a transparent system.
The transparency is so much important, and then when you are associating with a person, then listen to the her or him. You can't bypass them. So these are the things which I feel in future that we all have to collaborate.
Yes. So any technology you imagine will be a real disruptor for the industry, like where or an equalizer, as you say, that, the two parts of the industry, whether it's professional salon people, vis-a-vis the dermats, the cosmetology dermats, were so actively so important. When it comes to aging, I tell you that's all.
Now we don't get offended. We take pride in being cosmetic dermatologists.
So anything it comes to your mind which will be a disruptor, which will, because artificial intelligence, for example, is becoming a disruptor in many industries.
For us, as I always say, we have robotic surgeries and we have robots in our field also. But somehow in both our fields, we need that face-to-face contact, and we need that empathy.
Yes.
I have to understand that why. My husband is a surgeon, So whenever there is a medical gathering, our friends are there. So it's a running joke. Dermatologist patient, they don't die, they don't get okay. You get them in the hedge, and those kind of things. So my only answer is that patient is so much in my confidence, have so much faith in me, that whether they get okay or not, they will listen to me. Yeah. So that communication and that empathy, artificial intelligence can never take. Why? Why the problem is that aspirations of everybody is very, very different. When the patient or a client comes to you, what they want, they think that once they have entered your clinic, or once they have entered the parlor, once they have paid for a certain package, things are going to change drastically. So I always tell people, I can manage what you have. I cannot change you. Yeah. And I cannot peel off your skin and put, believe me, the teenagers these days, the younger generation, they are in a hurry. They're really in a hurry. They don't want to, if I tell them, beta, acne will disappear by the time you're 20, just take care so that the marks are not there. Oh, ma'am, when I cross 20, you do the surgery. You remove my skin and put another one. I said, no, there is nothing like that. That's because उनको लगता है कि अभी इतनी मेहनत इतने साल करेंगे, उसे चाहिए मामा चाहिए आपके पास अपना स्किन फील करके. So artificial intelligence can never take charge of us, we will, believe me, we will become better with times. Because what I have realized in these times of Google, when everybody knows everything, I take it as a positive thing, because what I do is, whatever my assessment is, whatever my diagnosis is, I will write in bold letters on my prescription paper and say, go and read. Read this only. Don't, internet pe thakke mat khao, ye padho, so that you are on my side. And next time you come, I'll ask you questions. So
True. That's a good.
we have to become. हमारे यहाँ कुछ disruption नहीं होने वाला, हमारे यहाँ बेहतर ही होगा, because we are people's person. हम लोगों से interact कर रहे हैं, हमारे लिए वो कोई मशीनें, कोई procedure, हमें सिर्फ जरूरत ये है कि what we are getting new, what we are getting from the West, we should use it according to our parameters. It's not that you can do anything like peels. I told you 70% glycolic peel. I cannot even do in my dreams. These were done by the plastic surgeons because they didn't know how our skin will react. The skin reacted by producing more pigment. So the patient was totally burned. Today, the maximum amount of peel that I'll do is 25% glycolic acid, because the brown skin can take only that.
Yes.
So we have to get more technology. As I told about the vampire facial, that's the biggest new. So once we started doing the PRP, that's called the platelet-rich plasma, what we are doing as a vampire facial, the plasma. We were doing it for hair growth also, we are doing it for skin glow also. Then we realized there are the grow factors available synthetically. And the grow factors which are available synthetically are amalgamation of 10 grow factors. Maybe your plasma will have only 2.
Oh.
So everybody has, and these are not derived from any human being, so they will not transfer any disease or anything. And plus, using them was more economical, and using them gave more better results. And then we didn't have to withdraw blood also, because initially when we started here, Ritoo used to be 20 ml blood. 20 ml is a big syringe. तो पेशेंट तो पहले ही फेंट हो जाता था.
True.
तो अब वो आ गया है, 6-7 ml पे आ गया है, पर अगर आपको ब्लड ना विड्रॉ करना पड़े तो क्या मजा है.
Yeah, always better. Especially if you're coming to a dermat, that's one place you don't want your blood. You don't want to look at your blood.
I tell you ना, I always tell patients कि भैया dermatology के patient को needle syringes नहीं चाहिए होती है, जिसको वो चाहिए वो plastic surgeon के पास जाए. So I have a mesotherapy, and I actually have a non-invasive mesotherapy because I don't need needles and syringes.
Fantastic. So a valid point about customizing those new procedures to Indian realities, Dr. Shehla. Now I would like to talk about if you could share some insights on how the customer is evolving, what age group is asking for what, and how you are kind of like, as you just related about the teenagers being very, wanting quick results and so on. So how do you also tackle those demands which might sometimes be unreasonable?
That's my job, to put them in place. As I always say, I never promise the moon. Let's start with the teenage group only. As I told you, they are unreasonable. Okay.
Yeah. What percentage of your business comes from teenage? Like, what are percentage of your patients are teenagers?
At least 60% patients are teenagers, because that's the time when the acne is more and when the mood swings are more, and they can throw tantrums at the parents. So it's the parents who are paying for them. So, the money is not an issue, because I've evolved with, then we come to 16 to 17, 18 years old. The problem is, we are talking of mental health also these days, and somehow or the other, we have lost that control on parenting. Let me deviate from here. As a parent, I always tell my daughter, I have one daughter, that I am your parent. Okay, everybody can be your friend, but parent can be only one.
Yes.
So the parent has to teach the child to face the realities of life, which can be failure also, and which can be good things also, but bad things also. आजकल तो वो उसमें हाथ में लेके घूम रहे हैं कि oh, my child is depressed, and you are not giving them the mental support which the child is supposed to be there, and you cannot take care of every tantrum. तो डांटते नहीं हैं. So believe me, one of the girls who came to me with her parents, and she said, oh, she want to do this and this and this and this. And I told that girl, beta, तुम मेरे यहाँ आए, तुम घर से निकले, वेस्ट दिल्ली से कहीं से आए थे, तुमने बालों में कंघा तक नहीं किया, you didn't even change your dress. तो जब तुम्हें अपने वजूद की ही अहमियत नहीं पता, you don't care about your personality, changing the physical appearance is not going to change who you are.
Yes.
You have to feel beautiful from inside. You have to feel that confidence from inside. इसके दो पहलू हो सकते हैं. Maybe she thought that because she doesn't have that, so she doesn't feel confidence. So yeah, it's my job to tell the parents, and believe me, the parents were very happy कि किसी ने ये बात बोली.
Right.
कोई ये बात बोलने को तैयार नहीं होता कि बेटा पहले अपने ऊपर काम करना शुरू करो, then only the other person can help you. So as parents, we have to do this. Then comes the next generation is 25 to 30 who have got the job, who've got the credit cards. They still don't have any responsibilities. The money is being paid by the parents. They just want to swipe the cards for everything. So every airport, they'll pick up something. Every treatment, they'll come and ask you. Unke saath dikkat ye hai, they don't want to listen to you. So then I say, beta, why do you want to listen to your voice? You have come to me because you have a problem. You try to solve it and you don't solve it. So now you are here. Now you have to listen to me. So why I'm saying this is because even in the cosmetic industry, people come over there, go to the parlors and say, I want glow, I want fairness, I want this. So everything business aside, देखो business क्या होता है कि एक बार आके चले. I've been in practice for 20 years and I still have those patients who have been coming to me for 20 years. So because they believe कि जब वो यहाँ आएंगे तो वो चीजें, I have a reputation of being very up to front. I'll tell you whether this is right or wrong, and I think it pays in the long run. It really pays in the long run. Then we come to the 40s. This is the new young. I'm 50 and 50 is the new 30s. Okay.
Especially in your case.
When I started practice, I distinctly remember there was a lady and I told her, why aren't you taking care of yourself? She says, oh, I'm 40 now. The world is over. Like, you know, that was the mindset 20 years from today. Now that mindset has changed because 40 to 50 is the time when you have taken care of your responsibilities. The children are settled. They're going through their education. Financially, you're settled. So now is the time where people are taking care of themselves. So this is the age group which has increased in our practice. Yeah. That change teenagers were always there. Yeah. But the 40 plus age group is now coming. And now another age group which has gone up is 70 plus ladies, because now the life doesn't end with age basically. Yeah. Yeah. So the awareness, the availability and the marketing, in the sense that they know that something like this is available. As I said, every 2 years I have to get a new procedure. People will come and ask me, ma'am, when are you doing this? So the awareness is there. And similar way, I feel even in the cosmetic industry with all the cosmetic and dermatology. Dermatology, the problem is when I write something, they say, oh, we don't want to use chemicals. दवा भी तो कहीं से बनी रही है. A cream is a paraffin wax. Even the lipstick is paraffin wax. So the idea is that, but what we need to do is include more Indian things, like the essential oils, the Ayurveda. But unfortunately, there is not much research on this. वो जो है वो by word of mouth हो रहा है. So कहीं ना कहीं we have to get between two streams and develop products which are not medicines, but which are not purely creams. So they are cosmeceuticals basically. Correct.
That's a very growing field actually.
Yes.
There's a lot of clinical research also happening there.
Yes.
So yeah, indeed, that's interesting, the age groups that you were talking about. So moving on, we will now talk about COVID, you know, how impacted we all are, the whole world is. And in India, it's, you know, it's now reaching the peak. We are in mid-June and we are fearing that, especially in Delhi, it's going to really go higher. So how have you taken this challenge, Doctor? And what do you suggest? I'm sure that you have unique insights into it, being yourself a doctor, and you both are doctors, and you know, I'm sure that you have something very significant to say to us.
First thing that fortunately, I believe, as I've talked to all my friends in UK, USA, we have one thing about this COVID situation is that we all have started connecting on Zoom call once a week. So people whom we had not talked for 25 years, because everybody is locked down, everybody needs to know what is happening over there. Everywhere, the COVID reached a peak and it declined because the virus loses its steam. In the sense, the virus, the virulence, the ability to cause infection decreases. So I am really positive and I am really hopeful that this will decrease. But you have to understand it's not going to go anywhere. Oh. It still will be around. This is not unless we get a vaccine. But even if we get a vaccine, it will not be for the masses. Like they will not be able to produce that much of vaccine to give to each and every person. So we have to basically change our habits. हमें वो permanently अपनी वो करना पड़ेगा. अभी जैसे salons खुलने लगे हैं. I opened my clinic. Before I opened my clinic, I had to change the whole setup of the clinic. There has to be less sitting place. There has to be a sanitizer. There has to be a thermal gun. We didn't let people come in, the relatives come in, the contact is less. The salons will also have to learn that they have to work with shutters shut. In the sense, you give appointment to 2 people and throughout the day, because that day I told you when my parlor opened and I went for my hair color and all, there were 2 people, me and my daughter were there. But somebody just walked in, can I get an eyebrows done? उसको टेंशन नहीं थी, मुझे टेंशन हो गई. You know, you don't want random person to come, and which will be a very big change in both our industries. We thrive on walk-ins. Like, you know, you decided that you needed to see a dermatologist today and you had time and you just walked by. You knew that I'll be available at this time. वो अब नहीं हो. Correct. Everything has to be by appointment, and the earlier we get used to this, the better it is. We might have to work, and we will work with less staff, because when the work is distributed, that day I was sitting and saying, oh, wo zamana chala gaya when there used to be a waiting of 1 hour. It's actually gone, and it will not come back. It will not come back for another year or 2. So we all have to learn to maintain the social distancing, and we have to learn how to carry it on. I have seen it that people start with lots of zest कि ये भी पहना है वो धीरे by the end of the day पहले shield उतरी, फिर mask उतरा, फिर gloves उतरे, and you say कुछ नहीं होता, because these things are uncomfortable. It's not easy to talk in a mask, it's not easy to work with gloves. So you have to understand कि कहाँ आपको gloves चाहिए, कहाँ आपको shield चाहिए. For that matter, because I'm talking to you, I want to highlight what the industry people have to learn to do is, if you wash your hands for 20 seconds with a good soap and water, then there are no chances of the virus being there on your hands. So then you don't need to wear the gloves to do the waxing or threading. Right. You have to apply the logic. It's not that कि आपको एक सामान पकड़ा दिया गया और आप उसे पहन के, because threading, waxing gloves के साथ करना impossible हो जाता है. So there you have to do that, but when you are near to the person, the mask has to be proper, and the mask has to be a very proper one. The mask cannot be, it has to be, I'm wearing earring. The mask has to cover the nose from here and the chin from here. Otherwise it makes no sense. Now the problem people face is कि अगर वो specs पहन रहे हैं तो वो fog हो रहे हैं. तो आप इस मास्क के ऊपर यहाँ पर एक टेप लगा लीजिए, so that the air does not escape. वो escape नहीं करेगी, तो आपके glasses fog नहीं होंगे. Right. So you have to understand, and this mask has to be 3-ply mask. 3-ply means there has to be 3 layers. These are 2 layers, and there has to be 1 layer in the middle. So the purpose has to be understood. There are 3 C's which we have to learn. We have to avoid close contact in closed spaces, and consistently there has to be a gap. आपने एक क्लाइंट किया, आप आधे घंटे जाके बाहर बैठ के सांस लेके आइए. You know, your immunity has to work. So it's not that I started my clinic, and after talking to 10 people continuously, I was breathless, because to talk in this mask and you are inhaling your own CO2, carbon dioxide, so that makes you dizzy. So after every half an hour, you'll go take out the mask, breathe in, breathe out, do the Kapalbhati. These are really, really important. So you have to understand why you are doing what. ये ऐसे लगा के मास्क घूम लिए, उससे क्या फायदा हुआ? So you're not showing it to anybody. So these changes have to become ingrained in us. It has to be an instinct. वो instinct अभी हम में नहीं आया है.
Yes.
तो जब हम काम करना शुरू करेंगे तो हमें ये इंस्टिंक्टिवली सब कुछ चीजें घर क्लिनिक आके अपने उसमें आके आपको हर वक्त पीपीई पहन के बैठने की जरूरत नहीं है ना. पीपीई इज पर्सनल प्रोटेक्टिव गारमेंट. तो आप क्लिनिक में बैठे हो, कोई पेशेंट नहीं है, आप पार्लर में बैठे हो, कोई क्लाइंट नहीं है, आप क्यों पहन के बैठे हो भाई? आप सिर्फ यूर स्वेटिंग योरसेल्फ. मतलब यू नो I saw this happening and then आप वही फिर थोड़ी देर बाद वो सब उतर जाता है.
Yeah, because you're so flexible.
So there should be one room designated in every parlor कि when the client comes and whoever is going to take that client will go in, wear the PPE, first wash the hands, wear the PPE, then start working. वो सुबह से रात तक पहन के खड़ा होना नहीं बनता. So COVID is not going anywhere. We have to learn to work with it. But my request is that now we are doing it on 16th June. At least till 30th of June, till mid-July, protect yourself, because this is the peak. Every second person, and the problem is that people are asymptomatic. They're asymptomatic shedders. उनको कोई symptom नहीं है. उनको बेचारों को शायद खुद नहीं पता कि उन्हें COVID हो गया है, but they're spreading the virus.
Yeah.
So that's my request through you to all the people in the industry. Work with appointments. Don't let a number of people. अगर आपके पार्लर में 6 चेयर हैं तो 2 चेयर काम करेगी. And do keep your shutters closed in the sense that, you know, do something with say कि we won't allow the walk-ins inside. वो लालच नहीं चलेगा कि अरे काम है आने दो. वो काम नहीं है, वो आफत है.
Okay. So what can we quickly have your your I think very informed thing of assessment of what's happening on the drugs front. So there is HCQ, then there is remdesivir or whatever, I can't even pronounce it. And then yesterday there's this whole thing about
dexamethasone. There are 2 phases. What we have to learn is that हर ड्रग का अलग अलग कॉन्टेक्स्ट में बात हो रही है. जनरल मीडिया में जाके वो सब मिक्स हो जाता है. HCQS, हाइड्रोक्सीक्लोरोक्वीन, प्रोफाइलेक्टिक ड्रग. प्रोफाइलेक्सिस मींस वो आपको बचा रही है. जब बाहर से फॉरेनर्स, वेस्टर्न पीपल जब इंडिया में आते हैं, उनको 6 हफ्ते पहले एंटी मलेरियल प्रोफाइलेक्सिस शुरू कर दिया जाता है. Which is this HCQS कि इसका लेवल हमारे ब्लड में इतना बन जाएगा कि अगर आपको मलेरिया वाला मच्छर काटेगा भी तो वो ब्लड लेवल जो फेल्सीपेरम जो आएगा अंदर आपके, वो मर जाएगा वहीं के वहीं. It will not be able to infect you. So this is prophylaxis. We as medical professionals have been advised by ICMR, Indian Council of Medical Research, and we have started HCQS. हम लोग मार्च से खा रहे हैं और ये हम बिलीव कर रहे हैं कि अब हमारा लेवल बन चुका है. फॉर द सैलून पर्सनल्स एंड ऑल अंडर डॉक्टर सुपरविजन. देखिए कोई भी ड्रग अपने आप अकेले नहीं लेते हैं, क्योंकि हर ड्रग का कुछ ना कुछ साइड इफेक्ट होता है. साइड इफेक्ट क्या है कि 1000 में से 1 को होगा, पर अगर आप वो 1 हुए तो आप तो गए. तो अगर आप HCQS की प्रोफाइलेक्सिस शुरू करते हैं, पहली बात है तो नथिंग इज प्रूवन. It's a new virus. That's what it's called, novel coronavirus, because nobody knows anything about it. We are working on the assumptions जो पहले हुई हैं. पहले की स्टडीज के हिसाब से हम यहाँ जा रहे हैं, because इबोला जो नाइल में आया था उसके लिए भी HCQS प्रोफाइलेक्सिस वर्क किया था. एंड दूसरी बात ये कि प्रोफाइलेक्सिस काम कर रहा है कि तो आपको पता चलेगा ही नहीं ना भाई, आपको डिजीज नहीं हुई, तो ये तो अच्छी बात है ना. कि तो मैं मानती हूँ कि प्रोफाइलेक्सिस अगर आपको नुकसान नहीं कर रहा है तो उसको लेने में कोई नुकसान नहीं. अब आ जाती है ट्रीटमेंट वाली बात. ट्रीटमेंट जब है डिपेंड्स ऑन द सिवियरिटी ऑफ द सिस्टम. कोरोना के साथ दिक्कत क्या है, हर आदमी का सिम्टम अलग है. किसी को सिर्फ बुखार में निकल जाता है, किसी को पता भी नहीं लगता है, कोई कोलैप्स कर जाता है. तो अगर आपकी सिवियरिटी, खुदा न खास्ता आपको सिवियर डिजीज होती है, तब हम ये डेक्सामेथासोन इज अ कॉर्टिकोस्टेरॉइड. वो तो मैजिक ड्रग है, मरते हुए आदमी को खड़ा कर देता है और हम हमेशा से यूज कर रहे हैं. तो बात ये है कि अब मरता क्या ना करता, डॉक्टर्स पूरी दुनिया में दे आर ट्राइंग एवरीथिंग. So then we are, तो आप ये प्रे कीजिए कि आपको वहां तक जरूरत ही ना पड़े कि आपको रेमडेसिविर या डेक्सामेथासोन की जरूरत हो, पर precautions is the only thing which will prevent you. If you feel that you are working in a very high risk environment, मतलब आप बहुत सारे clients को deal कर रहे हो, तो आप एक डॉक्टर से, it's the salon owners के वो डॉक्टर से बात करके एक normal checkup करके, normally your workers are very young people, तो उसमें इतना फर्क नहीं पड़ता है, so they can start with the prophylaxis. Prophylaxis में कोई नुकसान नहीं.
Sure. Okay. That's very interesting. Thank you so much. So now we're coming to your personal regime. You know, we would love to hear what makes you happy. What's your regime for yourself? Skincare, hair care. You know, what you do. You know, internally, like you meditate and walk. What is your fitness regime? Let's talk about that as well.
I'm a Pathan by genetics, so when I picked up dermatology as a branch, I was told you are the right person. But it helps because I know what the changes, skin changes are happening over the years. I am one person who's very particular in the sense I'm not very adventurous. I know my skin, I know my routines, I know when it needs moisturizer, I know when it needs cleaning, I know that I need 8 to 10 glasses of water, and it's my routine.
Right.
I don't have to think about it.
Sure.
In my house, and I always tell people there should be different colored bottles. There are 2 bottles of single color for every person. So आपको दिन भर में वो 2 bottle पीनी है. तो आपकी 2 येलो बॉटल है, तो आपको 2 येलो बॉटल सुबह भरी जाएगी, रात तक आपको खाली करनी है. So these things have become norm. मतलब वो रोज का रूटीन है, उसके लिए किसी को कुछ करना नहीं पड़ता है. I am as such, I'm known as Jhansi ki Rani because I don't take any shit from anybody.
That's a good.
I am a very upfront person, and because I smile a lot, so my daughter says कि लोगों को पता भी नहीं लगता कब उनको थप्पड़ लग रहा है. So
children know us in and out.
But I will not bear it. I will not take it home. I will not sit and dwell on it. That's my personality. That I'll keep it in front of you. किसी की बेइज्जती कभी नहीं करूँगी, whether it's the staff or anybody. But I'll make my point through to you that what you are doing is not correct. And I always take it as my responsibility that as an educated member of the society, it's my first to sometimes tell people what they don't realize. So I think that keeps me happy, whether it keeps my husband happy or not, but he knows कि ये जो है बोल देगी तो. I was telling him that your mother was saying this, तुमने मेरा side नहीं लिया, कहते तुम काफी हो. So I feel in today's mental health scenario, when there was the lockdown, we as a family had formed a schedule that we'll get up, we'll sit outside, we'll have chai together, then we'll watch TV or music or dance. Like there were twice a week, I love to dance. So we'll put up dance music and dance. And my daughter loves cooking, so there were exotic dishes. So there was nothing, I was enjoying that vacation because we working women, you know, we never had that time off. We have been constantly like on a clock, on an alarm clock. So that's the solace. If you are peaceful with yourself, I might not have everything, but I have more than millions of people, and I thank God. Khuda ka shukr hai. Literally Khuda ka shukr hai ki whatever is there is there. So the idea is keep yourself happy, keep your mind very clear. I can't meditate because my mind works faster than so what I speak,
everybody needs to meditate because, you know, while they are acting, they are so mindful already that's, you know, in action also, why you can be mindful and meditating. I think, you know, you might be a person like that, you know.
Exactly. I am a very creative person in the sense I write poetry, so that's my out, and then I do lots of other things. I'm a good organizer. I'm a good master of ceremonies. So any function or anything, I'm the one with the mic. Me without a mic is a very difficult thing to find in any function. So that way my creative energies. But frankly speaking, I thank God I'm not in a creative field. I would have gone actually mad. It's not a right word to say these days.
You're a person with structure, at the same time you have
Yeah,
lots of
exactly. And then I have friends like you who keep a tab on me, who make me smile.
So, fantastic talking to you, Dr. Shehla Agarwal, and great information about COVID, a lot of insights on dermatology and how salon and cosmetologists in salon should, function. And we will take you up on the trainings as well very soon. And all the best to you. Thank you for being with us at Beauty of Spas. Thank you.
It's been entirely my pleasure. You have made my day. I have laughed so much in this last half an hour. So my dose for the day is done. And we will collaborate. And everybody, please be safe. Only you can take care of yourself. No one else can. Take care.